Here on location in downtown Bluffton to celebrate the next chapter of MiraSol Health with the CEO, James Dismond. Congratulations.
Thank you. We're so excited to have you guys with us.
Well, it's going to be a wonderful celebration. You're going to be talking about your programs and thanking the community. So let's kind of review what the drill down is of the event.
Yeah, it's been a long journey. You know, we've been on this journey now for 42 years as an organization. The community is familiar with hospice care of the Lowcountry. So tonight is about celebrating how our brand has evolved and how we're evolving to serve the community for 42 more years. So we've been on a 2-year journey to get the name change to happen, and transitioning from hospice care of the Lowcountry to MiraSol Health is just a huge milestone for us.
And so for our viewers that aren't familiar with MiraSol, what that stands for in the rebrand, what is it? I know you're keeping with the theme of the purple and the yellow and the sunflowers, but what does it mean?
Absolutely. So everyone's familiar with the sunflower. It's been part of our brand for years. And MiraSol, when you break it down, means radiant and abundant sunflower. So the sunflower represents many different things. The petals are the services that we provide and the care team that surrounds the core. The core is the patient, because we're always patient-centered and care-focused. So together we can serve this community in its entirety and represent more than just hospice, which is what MiraSol is all about.
And so you mentioned services and the programs, which have continued to grow, the depth and the breadth to serve the patients. So you want to share a little bit about that?
Yeah, so tonight we're going to be announcing not just the extension of our hospice care brand into 2 additional counties, but we're launching a broader scope of Lowcountry palliative care into the hospital systems locally and into 2 additional counties, as well as Rays of Hope behavioral health, which will help the mental health realm in our communities. And we're renaming and rebranding our volunteer program to become the Maggie Clark volunteer program.
For Maggie Clark.
For the late Margaret Clark, yes.
Wow. So your team, your staff, I mean, they're in volunteers, of course, but your staff is just so professional and all experts in what they do. How proud are you of them?
So proud. And I love that you said expert, because hospice and palliative care is a specialty. And we need everyone to realize that we are specialists in the end of life and in chronic symptom management. So with the community growing, we're growing. We now have over 50 staff members serving our more than 230 patients.
Oh my gosh. And that number has grown over the last few years, hasn't it?
It has. Over the last 2 years, we went from 45 patients to 230 per day.
So next chapter, you mentioned 2 counties. So is it Colleton and Hampton?
Colleton and Hampton counties are 2 of the most underserved counties that are closest to us. So it's important as a nonprofit that we serve and provide access to medical care, specifically hospice and palliative care and mental health in those communities.
You mentioned palliative care several times. Would you again define that for us? It's such an important component of what you do.
Yeah, and it's ever evolving with us. So palliative care to MiraSol Health is essentially serious illness management, where we look at the patient in a holistic form and help manage the symptoms that you have associated to your chronic illness. And we collaborate with your providers outside of our organization. So your primary care provider, your specialist, your home health, your caregivers, all of those individuals, and we keep them all on the same page every day.
I think the theme of tonight is compassion in action. So, I mean, it's such a perfect definition of really what you all do, the passion, the compassion, the heart, the soul that you and your whole team put into your work. So you want to make a comment, kind of a concluding comment about that?
Absolutely. Compassion and action to us is growing with this community. We're committed, we're connected, and we're here for another 42 years.
Thank you so much, James Dismond, who is the CEO of MiraSol Health, as we look at the next chapter.